particularly people that care for cancer patients, I think there is an understanding that people's spirituality in whatever shape is an important part of their experience. And so I think people think it's a little strange that I would do the research work that I do to kind of elucidate the role of spirituality in illness, but at the same time there's an understanding of, yes, this is a key aspect of so many patients that we care for. It's hard to ignore. So I think I remember being very afraid of going along this path. In fact, my original plan going into radiation oncology was that I was going to be more of a bench researcher, what's called translational research, which is kind of bringing bench research to the clinical setting, being someone that kind of plays that role. And so I even had a project that I was going to be doing, and ultimately, after this sort of experience over the course of internship, I knew that my calling was to do research work at the intersection of spirituality and serious illness. And I was very afraid to tell my residency program, where I was doing my training in radiation oncology, of my decision to make this change, particularly because it was so odd. So there's a lot of fear, and I think some of that was because I thought that they wouldn't be receptive to the type of work that I was aiming to do. And amazingly, once I finally got up the courage to let them know that I wanted to make this switch away from what would be sort of more conventional for a radiation oncology trainee to something that was fairly unconventional, there was an amazing amount of support and receptivity. I think within medicine, there's many people who understand how our care is so technical that we can miss the bigger picture of what it means to be human. And so for some, even a real encouragement of me to pursue this route. Not that there haven't been naysayers. There definitely have been plenty of naysayers who think that what I'm doing is a waste of time. But I was surprised by the number of people that were very supportive, and I think that comes from kind of a visceral sense that this human aspect of medicine is missing, and it needs work, and it needs to be developed.